Hi, everyone. My name is Carlos Hernandez, and I want to present Speaking the Same Language but Not the Same Way, exploring Spanish communication in healthcare. And I'm working with the HELIOS lab and Dr. Bilimek to conduct this research study. Before I dive deep into my research, I want to ask a question for y'all to think about. Have you ever heard someone speak your native language, but it still just didn't feel right? That was the case with my mom, in fact. She was at a medical visit, and although they provided a Spanish interpreter for her, she immediately knew something was off. Their tone was too stiff, the words they used was overly formal, and it just didn't feel like our Spanish. That moment made me wonder, if the language access is there, but the quality of language is mismatched, does it still count as effective care? This question came up once again, but at the Boys and Girls Club food pantry in Santa Ana, where I frequently interact with Spanish-speaking families. I bring this up because my club conducted an interview study where they asked questions in Spanish. However, the responses weren't much of substance. An example of this is this question. ¿Alguna vez has perdido una cita o no has podido programar un debido a compromisos de trabajo? ¿Con qué frecuencia te sucede eso? And the response was, ¿Dame un qué? Un grr. And even though it sounds like a joke, the main problem is made apparent. While we did provide Spanish to them, they fully didn't understand what we were trying to ask. This sparked a thought. If we translate this into healthcare, we still put a lot of emphasis on whether a provider speaks Spanish or the patient's language. But what if the real issue is how they speak it? And that's the heart of my research. My project explores this overlooked dimension by asking, does the quality and cultural appropriateness of Spanish used by medical providers impact patient trust, satisfaction, and care engagement in the Hispanic community? And to answer this, I want to conduct a audio vignette study where participants will listen to brief pre-recorded clinical scenarios, all in Spanish, but each version is different. One is a conversational style, formal Spanish, and non-native Spanish. After, participants will take a survey that takes elements from other surveys, such as CAPS that measures trust in a provider, CATS that measures communication with the provider, and IPC surveys that measure cultural competence of a provider. And if we find that language quality significantly affects patient engagement, it could change the way we train bilingual providers, not just to speak Spanish, but to speak it in a way that feels natural, respectful, and culturally connected. It could also inform improvements in interpretation services and even the way AI and language technologies are designed to support clinical care. In short, it's not just about speaking the language, it's about speaking it right. Thank you.